Hello, everyone. Thank you for joining us today for our webinar on compassion in oncology. First of all, I want to thank you for taking time out of your day to join us, and thanks to our team at NCCS for putting this together. I am really honored to bring you two amazing individuals from a group called The Patient Is You. We had the honor of meeting Claudio Pannunzio last summer when he joined us in Washington, D.C. for our CPAT symposium, and he told his story as a cancer survivor and how he uses his experience to help others. And then later he introduced us to Dr. Michael Crain of The Patient Is You, where they really work to empower patients and clinicians to really have compassion in their interactions. And they're going to talk to you today about how compassion helps not only the patient, but also helps clinicians and helps with burnout and reduces cost. So I'm really excited to hear what they have to say and to share their wealth of resources with you all. And I'm really honored to introduce Dr. Crain and Claudio. Thank you so much for joining us, both of you.
Thank you.
I will go first. My name is Dr. Michael Crain. I've been a radiologist for 35 years, working at a hospital and in outpatient offices in Connecticut. From the start of my career in 1988, to me, the patient always came first. I've worked throughout these years to provide top quality, cost-effective imaging exams in a timely fashion, and to provide same-day and immediate readings of these exams, as well as providing consultation with patients and their families. I listen to my patients and have worked to provide them with the care that they need. Being a compassionate healthcare provider requires integrity, tolerance, and compassion towards others, a tireless commitment to excellence, a willingness to work respectively and collaboratively with one's colleagues, and a spirit of true altruism and service. About 5 years ago, I was asked to be part of a nonprofit foundation, TPIU, to help promote compassionate healthcare, and I've been working since that time to spread the word about compassion. TPIU was founded on the idea of bringing the golden rule to healthcare. The patient is you. Healthcare providers should treat their patients as they would want to be treated. With this introduction, here are my thoughts on compassion in oncology and how it can decrease negative emotions and build confidence. Medical technology has grown dramatically over the years, saving lives and allowing people to live longer. 100 years ago, life expectancy was about 50 years, and now is approaching 80 years. Improved surgical procedures, drugs, imaging equipment, tests, and screening procedures all help to prevent and treat diseases. As technology and electronic medical records were developed and universally deployed, key aspects of medicine came to the forefront: quantitative analysis, metrics, population health, cost controls, and much more. Gradually, the work of the healthcare provider became increasingly digitalized and measurable, and payers, the insurance industry, regulators, hospital systems, and the businesses ran with it. The intention of these companies and leaders were understandable. They believed that standardization, documentation, and analytics improved productivity and the system at large, as if they were applying such principles to building a car or developing goods. But this process has led to neglecting the most important aspect of healthcare, the human connection. I can say with confidence, however, that these goals are not mutually exclusive. Healthcare providers will not succeed in providing compassionate care to their patients without a compassionate team around them. Chaos theory tells us that small and subtle changes can end up having massive consequences. Likewise, compassionate leadership breeds compassion throughout an organization. And as you may already know, compassion is infectious. That is why the compassionate healthcare provider must be the role model, demonstrating compassion not only to the patients, but to the entire healthcare team. Treating the healthcare staff with compassion will make them far more likely to play that forward, to treat one another and their patients with the same degree of care. The power of human touch, which was dramatically lost during the COVID pandemic, is well known to provide beneficial effects to patients. Compassion, when added to the human touch, is even more beneficial by lowering the stress hormone cortisol and boosting serotonin, the body's natural antidepressant and pain reliever. A compassionate healthcare team has been shown to improve patient outcomes and decrease healthcare costs, a win-win situation for everyone. When there is compassion and trust between the patient and the provider, the patient is more likely to follow their treatment plan and feel less stress and anxiety. This compassionate setting promotes better well-being for both the patient and provider. Compassion in healthcare is sensitivity and understanding of a patient's problems with a desire to help them. It is at once a feeling and an action. This is the very basis of being a healthcare provider, having empathy for patients and wanting to help them improve their health, well-being, and quality of life. With this in mind, to be a provider without compassion is not to be a provider at all. It is important to understand what compassion really means, and once understood, it's easy to see why it's so important in healthcare. Sympathy is an emotional reaction to pity towards the misfortune of another. For example, I'm sorry to tell you about your colon cancer. Empathy is the ability to understand and accurately acknowledge the misfortune of another. For example, I'm sorry to tell you about your colon cancer. I went through this myself several years ago. Compassion, on the other hand, is the deep awareness of the suffering of another, coupled with a wish to relieve it. For example, I'm sorry to tell you about your colon cancer, and I'm going to refer you to several specialists who are experts in colon cancer, and I'm going to be there with you, monitoring all of your tests and treatments, and will do my best to be sure that you get excellent care. I will be in touch with you on the phone, and we will discuss your progress throughout your treatment. You will have many questions and concerns during the period of your life, and I will do my best to help you in any way possible. I think this compassionate setting is what we all want. We live in an increasingly diverse world, and each person who seeks medical attention comes to us with a unique set of experiences, needs, and concerns. Healthcare providers must take the time to listen to patients, to their fears, concerns, hopes, and dreams. It is only in this way, by understanding the patient, their experiences at home, work, and in the community, that healthcare providers can develop a meaningful and compassionate connection. This trust, the human connection, leads to far better patient outcomes, lowering healthcare costs overall, and to a happier patient and healthcare provider, both with more fulfilling life experiences. A compassionate provider works to understand the whole person, not just the disease or symptom, and this can have major effect on how a patient with cancer experiences their disease. Cancers can have significant psychological and spiritual suffering, and compassionate providers can help alleviate these negative emotions and rebuild one's confidence. Whether it be the initial diagnosis, the treatment stage, or the terminal stage, compassionate healthcare providers can help improve one's quality of life. Many studies have been performed to demonstrate the importance of compassionate healthcare and how it improves patient outcomes. There's an excellent book on how compassion increases patient outcomes at a lower cost. The book is called Compassionomics, written in 2019 by Tresniak and Mazzarelli. There is no doubt that knowledge, skills, and experience are all crucial in an oncology healthcare provider, but compassion is paramount for a person with cancer. The compassionate healthcare setting provides the backbone of treatment, providing the necessary support to the patient and their caregivers. There have been many scientific articles over the years demonstrating better patient experience and outcomes in a compassionate healthcare setting. An excellent article was published in the Behavioral Therapy Journal in 2017 by James Kirby about the well-being of patients treated with compassion. The article reviewed over 20 randomized trials with over 1,000 patients. They compared patients treated in a compassionate healthcare setting with those in a traditional setting. The patients treated in a compassionate healthcare setting showed a statistically significant improvement in well-being, self-compassion, and mindfulness, and also a significant decrease in depression, anxiety, and distress. This was a dramatic demonstration of the power of compassion. At TPIU, we work with people to understand the importance of compassionate healthcare, and we work to help providers give this kind of care. To help patients evaluate their provider, we created a simple questionnaire with 5 questions. Here's the questions to ask yourself about your healthcare provider. My healthcare provider, 1, listens attentively and spends enough time with me to understand the reason for my visit. 2, strives to understand my emotional needs. 3, shows sensitivity, caring, genuine concern, and compassion for my situation. 4, treats me as a whole person, not just a disease or a patient. And 5, communicates test results in a timely and sensitive manner. We use a 5-point scale to evaluate each question: agree, somewhat agree, neutral, somewhat disagree, or disagree. We consider a provider who scores agree or somewhat agree on these questions to be a compassionate provider. In summary, people with cancer have a variety of needs, including the need for medical information and honest advice, as well as emotional and psychological support. A compassionate provider needs to be able to help their patients' fear, sadness, and stress, as well as providing information about treatments, side effects, complications, and prognosis. A compassionate provider helps to coordinate family, support and care, and support for their patients' caregivers. A compassionate provider takes the time to understand your needs and works to help you through the complex maze of physical, psychological, and spiritual changes that occur with a serious disease like cancer. Many hospitals have already understood the importance of compassionate healthcare. TPIU's mission is to promote compassionate healthcare in the outpatient setting, which is so important for the ongoing long-term treatment and care of people with cancer. As often stated by the founder of TPIU, Dr. K.J. Lee, healthcare providers should have the skills to treat and the heart to care. Personally, in my practice, I say it's all about the patient. Either way, it's clear that a compassionate healthcare setting is a powerful antidote to a patient's negative emotions and can be a strong confidence builder. Thank you for this opportunity to discuss the medical side of compassionate healthcare. And now I'll pass the microphone to my esteemed colleague and cancer survivor, Claudio Pannunzio. Thank you.
Thank you, Michael. A brief background, when I joined TPIU, I was just coming out of my second cancer. And so I had the opportunity to witness firsthand the need for compassion when facing patients with cancer. Aside from being the senior vice president of TPIU, I am also a volunteer with the Cancer Hope Network. I provide emotional support to cancer patients and their caregiver. And I'm also a chaplain who's trained in psychological first aid, which is a particular skill to help people that are facing a traumatic situation. And cancer is one of those, especially when the doctor drops the C-bomb on you. But before I begin, speaking as a cancer patient, a cancer survivor, I'd like to express to you my boundless gratitude for the invaluable support that you give to cancer patients. Remember, the gift of your mere presence in the life of someone afflicted by cancer can be incommensurable. So thank you. So I'd like to follow Dr. Crain's presentation by sharing with you my perspective, as I call it, the perspective from the trenches, as a cancer patient, on how the compassion we steadfastly promote at TPIU can be implemented. So let's start by talking about compassion and kindness. We witness them every day. They play a significant role in our life and in diffusing a cancer patient negative feelings and emotions. Regrettably, in healthcare, compassion and kindness continue to be just mere words, ideals parked somewhere with a good intention to be implemented someday. Compassion and kindness need to become embedded in the healthcare culture, and healthcare teams must train and pay attention to how they deliver them, because compassion and kindness can be potent antidotes to patients' negative emotions. They are confidence builders that might contribute to improve the patient's outcomes. Delivering care with compassion and kindness doesn't require any major technological or infrastructure changes. It begins by offering our ministry of presence, which is the practice of full presence, really listening without interrupting, paraphrasing what the patient said, posing clarifying questions, withholding judgment, mirroring, standing with those who suffer in anxiety and fear, and conveying with both words and silence an openness that encourage the patient to share their true feeling and emotions. This helps them to feel truly cared and helps reduce the anxiety they experiencing about their own mortality. Thankfully, the symbiosis of medicine and technology continues to deliver great results in oncology. However, there is a compelling need to complement these notable achievements with an equal level of high-touch care. The concept of compassion and kindness are slowly establishing their roots in the industry, and caregivers have begun somewhat to appreciate the benefits articulated by Dr. Crain. But there are inevitable hindrances. The need to produce accurate and timely patient reports, the pressure of financial issues, adequate workers' motivation, and inadequate pay sometimes can hinder the ability to provide compassionate care. So the burden falls on a few. As a hospital volunteer, I work in medicine and oncology. I regularly come across cases of compassion fatigue, nurses, doctors who engage in highly emotional conversation with patients and their families. So we need to promote the role of compassion and kindness on both sides of the fence, for caregivers and for patients. In doing so, as explained by Dr. Crain, the positive results are multiple. We can talk at length about compassion, but in the next few minutes, I'd like to share with you what I think are the few ways to reliably deploy compassionate care. The first one, and if we can move to the next slide, please, is active listening. In my work as a first responder, I'm trained to provide psychological first aid to victims of trauma, such as major accidents or active shooter situation. For me, active listening becomes of paramount importance in order to provide tangible help to victims. Active listening is a healthy combination of critical, reflective, and passive listening. Active listening is observing what verbal and nonverbal messages are being sent by the patients. Encourages you to be aware of the present moment and to let go of any distraction and physical emotional reaction to what a patient is communicating. It is essentially a mindfulness practice. We must listen with our whole self and quieted mind, giving our full attention, being present and open to another person. It has been defined as hearing every dimension of the other person, both what is said and what is implied. It demonstrates towards the patient respect and fosters a sense of trust. While the practice of active listening may seem to many simply incompatible with the financial and productivity pressures faced by caregiver, its benefits totally eclipse the dangers and monetary cost associated with failing to actively listen, such as administering ineffective or undesired treatments or missing pertinent information that would have altered the treatment plan, risk of lawsuits, and overall failing to better serve another human being. In an article on patient care in the New England Journal of Medicine, Dr. Leviton and Eggman state that active listening empowers healthcare personnel to shift the patient paradigm by simply no longer asking a patient the question, what's the matter? By inquiring, what matters to you now? So focus on electronic medical record keeping, I understand it's unquestionably necessary. It constitutes, though, a barrier to active listening. Excessive focus on it, it prevents really the doctor and nurses from being present in the moment, not achieving the most basic goal, meeting the patient where she or he is at in the present moment. So how active listening can be implemented? Here are a few examples of easy to implement. Not interrupting a patient while they speak, not picking up the phone during a conversation, listening to understand, not to respond to the patient, facing the patient head on and maintaining eye contact. Occasionally nodding to show that you're really taking in what the patient is saying. The effectiveness of active listening is a direct function of the use of open-ended question. When we are in pain, and I know a few things about it, especially when we are traumatized by the possibility of dying. We simply are not willing to talk. Allowing patients to express themselves is both cathartic and therapeutic. Closed-ended question elicit a simple yes or no and do not help. Instead, posing open-ended question to both patients and their families can lead to obtain valuable and often undisclosed information. Here are a few examples. What's the most important thing we can do for you today? What do you understand your prognosis to be? Would you tell me more about this? What are your concerns about what lies ahead? What trade-offs are you willing to make? How do you want to spend your time if your health worsens? What do you want to make decision? Who do you want to make decision if you can't? Ultimately, let's not forget that a healing conversation, one in which the patient feels cared for, heard, and that addresses their suffering, can be an incredible positive emotional experience with practical and positive long-term reverberations. A doctor or a nurse's ability to show that they are actively listening to the patient's history, concern, stories, sometimes bad jokes, grievances, and etc., can make or break their success in building the trust. The second way of delivering compassionate care is through thoughtful caring, which is the embodiment of our compassion. In the simplest terms, compassion is our capacity to really see the suffering of others and have the aspiration to transform the suffering. The Dalai Lama defines it as a heartfelt outflowing of loving kindness. It is the ability to see the world through the patient's eyes, abstaining from quick judgment, recognizing the emotion they experience and that often they are unable to articulate, and seeking to address those emotions in a genuine, caring way. Any serious illness engenders suffering, but care teams can attenuate avoidable suffering by mindfully listening and understanding the emotion that a diagnosis, and especially a treatment, triggers in a patient, and intervene with kindness. This is emotional intelligence, which is the ability to perceive, use, understand, and manage both our own emotion and those of people around us. Here are some top-line benefits that I want to share with you about integrating emotional intelligence into healthcare practice. Emotional intelligence plays a crucial role in healthcare as it allows professionals to effectively manage complex patients' interaction and navigate stressful situations. Providers with higher emotional intelligence establish immediately a rapport of trust, communicate effectively, engage, empathize with patients, fostering, as Dr. Crain underscored, adherence to treatment plans, to better outcomes, to overall satisfaction, and mental health. Emotional intelligence improves teamwork, reduces workplace stress, and is an important skill set for maintaining safety in the healthcare environment. The third way that I speak of is generosity. Our kindness often manifests as generous acts. Generosity contributes to a healthcare provider's success as it strengthens the trust-based relationship with patients. Generous staff put discretionary extra effort into their service to others. An old saying goes, and I'm glad the research validates it, that when an act of generosity is performed, 3 categories of people benefits from it: the giver, the receiver, and the observer. Generosity is an integral part of humanity. Science has proven that both witnessing and performing acts of kindness produces oxytocin, which incidentally is the love hormone. Increased oxytocin lowers the blood pressure and increases self-esteem, which is very important in oncology. Kindness boosts serotonin levels, which is the neurotransmitter responsible for feeling of satisfaction, of well-being, or calmness. Is that important to someone with cancer? Kindness reduces the stress hormone cortisol and reduces the pain via the production of endorphins. So generous acts not only benefit patients and their families, but also the employees who perform them. Organizational generosity builds pride and creates a happier, more engaging, and less exhausting environment. So now I want to just briefly touch upon 3 ways that I think generosity can be extended. The first one is timely and enduring communication. The second one is gentle honesty. And the third one is support to the family caregivers. So let's move to the next slide, where we're talking about the first of the 3 aspects of generosity and timely enduring communication. The uncertainty that cancer can cause don't always end when the treatment ends. Cancer patients experience what is called spiritual distress and realize that their life, many aspects of their life, have changed in unpredicted ways. This inevitably triggers anxiety and worry about their life after cancer. So any delays in setting a medical appointment, beginning a treatment, waiting for a doctor calls to share MRI results, or receiving information about a new medicine dosage can be excruciatingly difficult to handle emotionally. Cancer patients want to find comfort in timely response, routine, and ongoing communication, as all they want is to know what will happen to them and what treatments they will get. Consequently, timely and ongoing communication helps patients to calm down, to feel assisted, and develop an appreciation for the provider. So what is this timely communication? Taking in very simple words, it's a tangible manifestation of empathy, an extra effort to show appreciation for the patient's suffering, one that has a positive impact in reducing the deep anxiety and fear that a patient experiences when waiting to know what's next. The second of the aspect is gentle honesty. Like a nuclear weapon, cancer is a high potency word characterized by no positive meaning. I've been there. I bought the t-shirt. I know what it tastes like. No cancer patient will ever forget the day of their diagnosis. It is a life-changing moment. This is the time when doctors and nurses must begin to engage in gentle, honest communication for the length of the patient's journey. Medical providers need to share the truth in honest, well-chosen words that project a sense of alliance with the patient. Doctors in particular should make sure that they take time to inform both patient and family in easy to understand language, the variety of treatment options that are available. This makes a patient feel that he or she is receiving the best guidance, that he or she is having a saying in the process, and feel confident that in concert with doctors and nurses, he or she is implementing the most viable decision about treatment. Healthcare personnel need to develop a language that helps guide the patient toward wise hope. Wise hope is that hope that transcends the severity of the illness and helps patient focus on living in the moment. And in the midst of their suffering, appreciate and savor all the good and positive that surrounds them in the present moment, and ultimately facilitate for them a more intimate understanding of the impermanence of life. Also, and this is strictly my personal opinion, although it's shared by some healthcare providers, caregivers should avoid the use of combat language. Combative statements such as, you can beat this, you can fight this, as a form of encouragement before and during cancer treatment have become very common in our language, even though patients, cancer patients, are painfully aware that the outcome is beyond their control. So studies have revealed that combat metaphors, when referring to cancer, might do more harm than good. People who die from cancer don't die because they didn't fight hard enough. If a treatment doesn't work, if a tumor progresses, patients who have been led to believe that they are supposed to put up this big fight against cancer may end up blaming themselves, mistakenly thinking that they lacked sufficient strength or will, when instead it is the treatment that failed. Ultimately, the use of war metaphor or combat metaphor just infer a power of control that a cancer patient simply does not have. So the third and final important pillar is support for family caregiver. Family members play a significant, important role in the life of a cancer patient. They provide both emotional and physical support, manage schedule, fulfill their daily necessity. Often, a family member is the only one who can assist a loved one diagnosed with cancer to cope with their fear, with their sadness, with their anxiety. And sometimes they end up providing even a degree of spiritual support. The role of these individuals can be instrumental in giving the support and encouragement that can motivate a patient to engage in self-care activities. So generosity and kindness in healthcare must transcend the patient and unquestionably extend to the family and whoever plays the role of the caregiver. These individuals are a precious complement to doctors and nurses. Healthcare providers must learn how to coach this individual to prepare them to fulfill a role for which they are not adequately prepared. The support they must receive empowers them both cognitively and emotionally to be able to dispense the care that is required by a loving one that is facing cancer. So I'm coming to an end, and I would like to end by sharing with you an African concept that is very dear to me. And it is represented by the word Ubuntu. Ubuntu is a concept underscoring that our sense of self is shaped by our relationship with other people. The concept comes from a Zulu phrase, Umuntu Ngubuntu Gabantu, which translates roughly in a person is a person through other people. It is a way of living that begins with the premises that I am only because we are. In practice, Ubuntu means believing that the common bonds with a group are more important than any individual argument and division within it. It is a word that captures Nelson Mandela's greatest gift, his recognition that we are all bound together in ways that are invisible to the eye, that there is a oneness to humanity, that we achieve ourselves by sharing ourselves with others and caring for those around us. In your work to alleviate the suffering of cancer patients, you carry Ubuntu in your heart. So I am here today because we are. And please remember, we all have the ability as people to dig into our human values, to go for the best of them in order to bring about healing and bridge the gap of suffering of all sentient beings. Thank you.
Thank you both very much. That was really wonderful. There's a lot of really nice comments in the chat, and please feel free to ask any questions now because we have about 15 minutes for questions. I want to thank you, Claudio, for talking about the combat metaphor and why we should not use that. I agree with you wholeheartedly. I think it's always felt really uncomfortable to me. I'm not a cancer survivor myself, but I just cringe when I hear it. And I guess for some people that might motivate them, but I hate the idea of people losing their battle because it implies exactly what you said. I just don't like it. So thank you for talking about that. I really appreciate that. I want to start with the question that was, what is the role of spirituality in healthcare? And I think you touched on it, but I'd love to hear more about your thoughts on that, from both of you, from Dr. Crain as a clinician and Claudio as a chaplain. I'd love to hear your thoughts on that.
Michael, would you like to start?
No, it's okay. I mean, I think that you have it much better under control when it comes to spirituality.
It's we are finally discovering the ability to bring to the forefront the concept of palliative care, that the spirituality of an individual is profoundly impacted when we have, when we facing ourselves, excuse me, with our own mortality due to cancer. We start posing to ourselves, and sometimes we inflict to ourselves pains in asking what I sometimes define the most absurd question: why me? And so with that comes, I hear a lot of people in my role as a chaplain saying, God is not there for me, or I lost any form of beliefs. That's what when your spirituality, more than your religion is a set of rules that you feel to have this connection, but your spirituality is really what makes you question that there is something greater that in moment of difficulty you can latch on. And so that is important. We need to celebrate the ability for cancer patient to express, to tap, to leverage their spirituality. So the team that help cancer patients need not to be comprised only of doctors, but also by psychologists, by chaplains, by people that understand, by ways of having, as the British say, having eaten the soup and taste what's like because they experience cancer, but also they have experienced themselves the crisis of saying, is this all there is to life? One day I wake up, I go to a doctor, says that I have cancer, and this is over. Me, that I always been a nice person, I always went to church or to synagogue, or I always done good. So we need to extract more value from the spirituality. We need to bring the spirituality to the forefront, because that's what is going to help the patient to find the comfort that you inevitably need when you are with cancer.
Yeah, to me, it's about asking those open-ended questions and listening, because many patients are very religious, are very spiritual, and others aren't. And I try to taper my comments and recommendations to what they need, because everybody's different.
Great, thank you. So there was a comment about how healthcare systems and practice administrators can either support or diminish the ability of even the most caring and compassionate practitioners to practice compassionate care. What is your advice to a clinician who is not in a supportive environment, where, the focus is on numbers or productivity or, revenue or, getting through your schedule? And how do you still bring in that compassion when you don't feel like the environment is supportive of that?
Well, first of all, to be compassionate doesn't always have to take that much more time, but in some cases it does. And so I think that even in a rushed situation, one can still provide some benefits of compassion. But I think that more importantly, and that's what TPIU is trying to do, is to let both the physicians and the patients know that compassion is important. And those healthcare providers can also promote that with their administrators and the systems that they are in. So I think that even if they start to talk about it, that we need a little more time to provide that kind of compassionate care, which does increase their patient outcomes at a lower cost. It makes sense. And in fact, we're going soon to the government to try to get them to promote this idea. And hopefully that will trickle down then as, the leadership trickles down to show that and to promote settings which can be used for that kind of care.
And if I may, Shelley, sometimes I use a very basic, more pedestrian approach when I talk to a doctor that I might feel that he is not in that compassion. And I just ask, imagine for a moment, TPIU, that the patient is you. What kind of compassion would you like to receive? And unfortunately, because of the impermanence of our life, one day you can be a cancer patient. You can be the best oncologist today, but you can be that. So imagine TPIU, that one day the patient is you.
Great. So Dr. Crain, you mentioned reduced costs. Can you say more about how we can reduce costs with compassion?
Sure. A very common, it's not a cancer question, but diabetes is a very good way, because diabetes costs so much money in our country. And it's been shown that the compassionate provider who explains to the patient why they need to take their medicine, why they should stay away from cakes and cookies and have a good diet, those people have less complications. So there's less ketoacidosis, there's less hospitalizations, and everybody does better. But it takes sometimes an extra effort. Some people are very compliant, but others, need that extra help. And most people, once they understand their situation, will comply. And but they need that extra attention. So that's sort of the easiest route. I mean, there are many other examples. Even a doctor who has openings for a semi-acute patient to come see them instead of sending them to the emergency room, whether it be a bug bite, and they need to see a doctor. The non-compassionate provider will often say, go to the emergency room at $2,000, a visit. And more compassionate one will have built into their schedule some slots for those more urgent cases because they care about seeing their patients and taking care of them. So those are two, easy examples, but there are many more.
Okay, so I'm going to switch gears because ask a couple of questions from a patient perspective, because our audience includes both healthcare providers and patients, survivors, advocates, caregivers. So how do you get compassionate care when you have access to an online portal and it may have test results that are there before your healthcare team can talk to you about it? Sometimes sensitive test results. I know this is it's mandated that these reports that the data go on the portal, and sometimes it gets there before someone can talk to you about the results. How do we bring compassion into that scenario?
Yeah, when that first came out, I was chairman of the Department of Radiology, and I just thought that was not appropriate. But now it's here. And I would suggest to patients not to look at their immediate results and wait for their provider to talk to them about it. That being said, as a practice, because I, of course, see a lot of things first, what I do is, and now with the electronic medical records, it's easy. So I'll chat the doctor and I'll say, take a look at this exam, because there's significant findings and you may want to look at it quickly before your patient does. Mm-hmm. I think that works out very nicely. It's just a stopgap measure. And sometimes I will actually not report the findings. I'll not send out my report until I talk to the doctor. Particularly if it's a new finding of cancer whether it be a mammogram or a CAT scan. I'll call them first. It does surely take extra time, and I'm not sure everyone does it, but to me, I think that's a compassionate thing to do, because it's the patient who's going to hurt if they find out first.
Yeah. Well, that's the embodiment of the mindfulness that we need to apply in the communication. It's first and foremost, we're trying to anticipate, to put ourselves in the shoes of the patient. What would be their reaction when they read something that they cannot fully comprehend? And so that attention, that brief moment of attention embodies the mindfulness and the compassion and the kindness.
Yeah, I mean, I've heard so many horror stories from patients hearing, getting a voicemail, on a Friday afternoon, and then they can't reach anybody and they have to spend the whole weekend worrying about the test results, or just finding out negative test results in really, ways that are not compassionate and could have and cause a lot of suffering that could have been avoided had it been handled better. So I think the patient is you is a good way to, think about it, and what would you want if you were in that situation. Another question from a patient perspective is, If you have a provider that's you don't feel like is compassionate, how do you deal with asking about a second opinion or finding a different provider when you don't feel like you have that compassionate provider?
Claudio?
Yeah, you can go. It's regards a doctor.
Well, I mean, I'm not in that situation, so you know, we tackle this with TPIU right now. At least in Connecticut, we're trying to begin sort of a file or sort of recommendations for those providers who are compassionate. But that's, you know, a lot of it is just word of mouth. And, you know, just asking others who's a more compassionate person in the office. Yeah. Because that's kind of what saves money too, is if, you know, the patients don't have to go searching around for someone who's good to them, you know, who takes that extra step to take care of them. You know, that costs a lot of money to go one doctor to another. But how you actually do it, I'll leave to Claudio.
Well, you know, it's the patient need to understand that if they don't receive compassion, they have to demand it. And one form of demanding it, it's because it's your right. You're not asking for anything that transcends any particular law. So today we have a lot of support system. We have, for example, cancer. There are organizations like NCCS. There are organizations as the Cancer Hope, and we all talk about the need of compassion as patients, and so we share those information, and we can ask directly to, as I did to one of my doctors. I said, I don't feel that I'm receiving the communication in terms of compassion that I need, so I need to look for someone else. You either help me recommending for someone, or I will go and I look. But today, the ability, and every patient should try to find a forum where to voice that. If things, it's like going to the restaurant. Some people go to the restaurant, they have a bad meal, and they never say anything to the restaurateur or to the people there. So the restaurant thinks that they have served you a good meal, and they continue perpetuating. That's why I'm a very strong advocate. That's why I keep speaking and talking to people. That's why I want to represent those who suffer, because we have today, with technology, we have a powerful platform to find the compassion that we need.
Thank you so much to both of you. We are at the top of the hour. Tell us where people can find out more about your organization and what you offer.
tpiu.org.
Okay, great. And we will post that link with the webinar, and we just posted it in the chat. Thank you so much, Dr. Crain, Claudio. We really appreciate it. There were some really wonderful comments in the chat. We'll share them with you afterward in case you didn't get to see them. I think this was really well received and very important information. So thank you very much. Thank you to everyone for joining us, and thank you to the NCCS team, as always, for making another successful webinar happen. I really appreciate all of you. Thank you, everyone. Have a great day.
Our pleasure.
Thank you so much, everybody. Bye-bye.
Bye-bye.